Good afternoon. I'm Seok Jung from the Department of Psychiatry at Assam Medical Center in Seoul. Today I'm going to talk with you about insomnia with the title of Sleepless Rainy Nights. In the process of diagnosing and treating cancer, insomnia is a very common experience. You have symptoms, you go for tests, you wait for the test results to come back, and you're very anxious, depressed, you don't sleep well. And now that you have been diagnosed, you're going to have surgery, you're going to have chemotherapy, you're going to have a hormone therapy, you are going to have all these different treatments. And the night before the surgery, you're going to be very anxious, you're going to be very tired, and you're going to be very depressed. And you're going to be sleepless. And then after the surgery, you are a little bit more relaxed. And then you're on chemo, you're on anti-hormones, you're on chemo, and you have insomnia again. And in some cases, there's recurrence, and you have to go through surgery again. So they go through the whole cycle of diagnosis and treatment. And at this process, insomnia is quite common. In fact, you look at some statistics on how common insomnia is. Depression, anxiety, and insomnia are the three most common psychiatric conditions. Depression is experienced by 4 to 5 people out of 10. Insomnia by 4 people out of 10, and anxiety by 3 people out of 10. So overall, it looks like about 4 out of 10 people have insomnia. That we're talking about the cancer patients here. Insomnia can be defined as having trouble falling asleep, waking up frequently in the middle of the night, and waking up early in the morning, or any combination of these three symptoms. When we think about insomnia, we tend to think of it as not being able to sleep. In reality, the much more of it's the waking up frequently in the middle of the night is much more common symptom. And when you're going through the process of being diagnosed and being treated for cancer, you're waking up a lot and you're not sleeping well, and you may have a temporary insomnia, and temporary insomnia gets better temporarily. But in some cases, it can be long lasting. If you have these symptoms 3 times a week for 3 months or more, it's called chronic insomnia disorder. Insomnia can occur for a number of reasons. The most common is that insomnia is triggered by stressful situations. It can also be caused by the disease itself, because it's very difficult and it's very difficult to accept to be diagnosed with cancer, and it's also difficult to be treated for the cancer. So it can be the diseases can be the cause of insomnia, and stress that comes with those of with financial issues can also cause insomnia. And when there is lack of social support, this can also lead to insomnia. There are many rooms with 6 beds in hospital. So if you go to men's ward with 6 beds, there are more than like 9 or 12 people in the room, because caretakers are staying there. But if you go to women's room, the six-person room only has 6 to 8 people. There are not that many caretakers. When men get cancer, their wives come and take care of them. When they are done taking care of their husband, they go home to clean up, take care of the kids, and come back to the hospital to take care of their husbands, and so forth. But when women get cancer, their husbands have to go to work, so their husbands are not able to provide the care. So the women are often left without a caregiver. This lack of social support can also be very stressful and can lead to insomnia and marriage and raising children in some cases. The disease was diagnosed before marriage, and so now the patient is at a common marriage age, but is not married. So this is also a source of stress. And also, it could be like this: I'm married, I have a young child, and I'm stressed out because I'm sick and I can't sleep, and I'm not able to take care of the child. And during this process of diagnosis and treatment, it can also be a time when I have to quit my job or my studies, and this can hinder my personal development. So there is often a disconnect from any kind of future career, so that is very stressful and also leads to insomnia. There used to be a time when depression in cancer patients was taken for granted, but more recently, there have been a lot of studies that have shown that if you treat depression aggressively, it improves treatment compliance or adherence and increased survival. So nowadays, it's pretty much accepted that depression is something that should be treated as a matter of course. But I don't think that's been recognized as much for insomnia. So people, it's a little bit common for people to think, oh, I'm going to lose some sleep during the treatment, and that's quite natural. So when they don't get treated for this insomnia in the hospital because they think like this, but they need to be aggressively treated because insomnia is also a very important factor in quality of life. Even after hormone therapy, there are hot flashes, night sweats, joint pain, and menopausal-like symptoms. So patients are frankly because of this, the patient can't sleep, and then they also wake up in the middle of the night. And these side effects make you wonder if you should continue to have hormone and therapy. But the reason we receive or we do hormone therapy is to prevent the cancer from coming back. So when you have side effects, it's more beneficial to actively manage these side effects so that you are better able to stay on hormonal therapy. And I think it's important to get help to stay on hormonal therapy. After chemotherapy, you're still very, very tired, and a lot of times you because you're lying around during the day because you're tired, you don't sleep very well at night. So what can we do to address this sort of insomnia? Let's say we sleep 7 hours because a day is 12 hours long. If you sleep 7 hours, that leaves 17 hours. If you have to be then you have to be active for 17 hours to get 7 hours of sleep. But what patients usually say now is that put me to bed for 7 hours and I will be active for 17 hours. I want you to think of it as 17 hours of hard activity and then 7 hours of sleep. The most important thing here is in order to get regular sleep routine is to figure out how you're currently sleeping and waking and what you do. There are four metrics. What time did you go to bed? What time did you fall asleep? And what time did you wake up? And what time did you get up? So these metrics are the most suitable means to assess and treat insomnia. I ask a lot of these questions in outpatient settings. How many hours would you like to sleep? And the patients will usually say, I would love to sleep even just for 5 hours. Some people will say, I want to sleep 7 or 8 hours. But if I ask from what time until when do you want to sleep, they say, I want to go to bed at 9 and wake up at 7. That means they want to sleep for 10 hours. So if you go to bed at 9 and wake up at 7, you would be sleeping 10 hours. Patients have said they would be happy with just 5 hours. And then they're actually saying that they want to get 10 hours of sleep. So what I'm saying is that when insomnia gets really bad, the amount of time I really want to sleep is really reduced. I just want to sleep, even at just a little bit. But when asked about from what time to until when they would like to sleep, they're going to ask for a longer time of sleep. Efficiency of sleep is actually sleep time versus time in bed, and this efficiency goes down. Patients feel that they are sleeping less. So to sleep better, you need to improve sleep efficiency. You need to decrease the amount of time you're lying down. So which is to say you need to decrease the denominator. Let's say you go to bed normally at 11 or 12, normally wake up at 6 or 7. This will be about 7 hours of sleep. Some people come and tell me they go to bed at 9 and wake up at 3 or 4 in the morning and they can't go back to sleep. So you went to sleep at 9 and woke up at 3. You've gotten 6 hours of sleep. That's enough. But the reason you can't go back to sleep is because you went to bed early. So you went to bed early. That's why you woke up early, and then you can't go back to sleep. The way to solve this is either to accept that you went to bed early and woke up early, or you can start sleeping later and get up at a later time. Conversely, some people try to sleep in, but they can't sleep at all, so they end up staying up late, and they then end up waking up late in the morning because you woke up late. You can't get back. You can't go back to sleep until late again. In the case, trying to go to bed early will only make get harder to go to sleep. The solution is to wake up earlier. I would say the most optimal sleep schedule is to go to bed around 11 and wake up around 6. That still gives you about 7 hours. You go to bed early, but you can't fall asleep as you stay up much later hour, then wake up at a much later hour. Do we open and close the door, or do we close and then open the door? We usually open and then close the door. The convenience store next door opens at 6 in the morning and stays open until 12, and then goes home and open the store at 9. So I open the store 3 hours late, so I have to close 3 hours late so I can make the same amount of money. But if I open late, I close the if but I close at the same time, then I will not make as much money. Just as when you open the store, it decides when you should close. When you walk up, should decide when you should go to bed. There are a lot of lots of habits that you should need to follow to sleep well. Just lying around during the day. Since I didn't sleep last night, I laid down during the day because I was tired. I usually people to think about lying down during the day as same as sleeping. I didn't sleep. I was just lying. But lying down is similar to sleep. I tell this. The reason we sleep is because we want to rest. So if you're lying down during the day, you're resting. So you are lying down. If you are lying during the day, your brain thinks you're sleeping. Do you eat 2 bowls of breakfast today because you didn't eat dinner last night? You don't do that. You wake up in the morning and it's a new day. You have to forget that you didn't sleep last night. If you lay down during the day because you couldn't sleep. But you shouldn't lie down if you're not going to sleep. But when I talk about this, patients tell me I'm so low on energy because of the cancer treatments. I have to lie down during the daytime, and because I can sleep, my stamina goes down, and I don't have strength, so I have no energy, so I keep lying down. What we call stamina is all about muscle strength. I don't lose muscle strength because I don't sleep. I'm losing strength because I'm lying down. So it would be more helpful to go in the direction of building strength by being active and eating well. Sleeping is about charging. If you leave your phone off all day, there is no reason to charge it at night. You have to have used your phone to need to recharge it at night. The same is true for sleep. You need to be active to be able to sleep well at night. This is the best thing for your health and better way to get to sleep. If you go to bed early, of course, you will not be able to go to sleep. And for you to go to bed early, you would have to have gotten up early in the morning. So if you woke up at 7 this morning, then you should go to bed at 12 tonight. So if you want 7 hours of sleep, then come back 7 hours from the time you finally woke up and think of that time as the time you need to go to bed. But some people say, well, we're supposed to sleep from 10 to 4 because that's when hormones come out. People say things like this. This is not true. Those hormones don't come out when you sleep. They just come out at night. I take sleeping pill and go to bed early, but I can sleep. Patients tell me this. Well, sleeping pills are not anesthetics. They are only effective when they are taken on the right time. People tell me that they take pills 30 minutes before they go to bed. It's 30 minutes before you are about to fall asleep. The best way to think about this, if I wake up at 7, I'm supposed to go to bed at 12, so I take it. The pill, I should take it before 30 minutes before that time. So uh, if you're not taking it on the right time, then the drug is not going to be effective, which means that you will need to increase the dosage. And also, people ask me what's the difference between a sleeping pill and a sleeping inducing drug. The distinction doesn't really make sense. Let's assume all drugs that make you sleep are collectively called sleeping pills, and there are several different types of sleeping pills with different mechanisms of action, and you choose the right one for the right condition. You can look at this. Can I take a sleeping pill? For example, you can't sleep because you're on hormonal therapy and you're supposed to be on the therapy for at least 5 to 10 years. You're not going to be able to sleep for 5 to 10 years. I mean, it would be much better to take sleeping pills appropriately and go to bed. But some say, isn't it dangerous to take a lot of sleeping pills? Of course, it's dangerous if you take a lot of it. If you take many hypertension drugs, if you take a lot of diabetic drugs, if you drink too much water, or if you eat too much rice, it can all be very dangerous. If you take too many sleeping pills, of course, it's dangerous. So the way to avoid too much sleeping pills is to get the right prescription for the sleeping pills and then take the pills at the right time at a minimum dosage. While under treatment, if it causes you too much difficulty of sleeping and you decide to give up treatment, well, this is not right. It would be better to be on the lowest dose to manage side effects properly. And can I take sleeping pills if I'm on chemotherapy? Sleeping pills don't interact with chemotherapy. So it's okay to take sleeping pills during chemotherapy. I'm on hormonal therapy and I'm having trouble sleeping. I feel hot, I'm flushed. Can I take sleeping pills? Of course, you can take sleeping pills, but I would recommend that you try something else first, such as antidepressants, in order to reduce the side effects of hormonal therapy. The conclusion. It's very common to have a disruption to your lifestyle while being treated for cancer, and it's very common for the chemotherapy to make you very tired, and it's very common for you to have trouble sleeping, and so you need to be active in order for 17 hours to be able to sleep 7 hours. So if you're going to get up at 7, then you have to come back 7 hours in order to know the time at which you are going to begin sleep. So when the time you wake up decides the time when you are supposed to go to bed or go to sleep. So that is the sleeping schedule that you should follow. You're going to be very tired when you are going through the chemotherapy and you want to lie down. But if you lie down, your muscle strength will go down. And so it's better to be active and to move around in order to build up your muscle strength. And that's better for your health and better for your ability to deal with this stress. I encourage you to go out of the house as much as possible, do fun activities, and eat a lot of good food. And so increase your activity so that you can sleep well at night. If you need sleeping pills, of course you can take them. And when you're going to take these sleeping pills, take the pills by calculating the time that you want to wake up. This is all I have to say. Thank you.